Okay, so everyone had their shake and they're feeling good, so we're going to get into heart disease. Okay, we're going to get into a very serious topic of some facts. Now, the one thing about heart disease, it's been such a male disease, right, for so long. Well, congratulations, women, you're now even. You've broken through that glass ceiling. And it is now a everybody disease. When it comes to male or female, it affects both. 90% of women have one or more risk factors for developing heart disease. It's the #1 cause of death in women, more than breast cancer. More than 82 million Americans and adults have estimated to have one or more type of cardiovascular disease. Okay? 50 million suffer from high blood pressure, which is one of the symptoms that will cause heart disease. So what we did in researching a presentation for you, Lauren and I, we wanted, because there's so much information. You put in heart disease in Google, you get so much. And what we wanted to do is just put that straightforward facts that I'm sure you've heard before. But we wanted you to have takeaways that you can do and be realistic about to prevent the disease and help you live a better and healthier lifestyle. And this is what we've done. Causes. The typical, right? Family history, lifestyle history. This is always kind of a fun way to start because I get a lot of, well, my mom, my dad, my grandma, my grandpa, all have had heart disease or high blood pressure, so I have it. That's why I have it. Well, did you find out the kind of lifestyle they lived? Did you realize that your dad ate a lot, drank a lot, smoked? Doesn't mean you have to get it. That's what we call lifestyle history. Now, if anybody remembers Dr. Silverman, he is somebody who preaches that a lot. And he really taught me the whole aspect of going back and looking beyond health history for somebody. But look at where the lifestyle changes started to differ and then where you can change. So it doesn't mean you have to get it. Now, obviously, we have to be aware of some genetic and family history things that do cross over, no matter how healthy you are. And those are certainly things that are going to be there no matter what. And we've seen it, and we've heard stories about people who exercise, eat right, and they die of a heart attack. But what I'm talking about is looking back and saying, well, I don't have to live or have that type of lifestyle that was there. I don't have to suffer from the same things that my grandparents or parents suffer from. Poor eating habits, obviously lack of exercise, stress, and smoking. So the obvious ones, I won't beat you over the head with those things. Symptoms. When we look at symptoms, these are just a snapshot of what symptoms are when it comes to a heart attack or heart disease. Some of these symptoms are there for a long time for people before they recognize that they have the disease or they're having a heart attack. Because as I go down here, lightheadedness and dizzy, I have clients who tell me, well, I'm like that almost every day. So what does that mean? Do I go to the hospital? Should I get checked out? It's about being consistent. It's about realizing and understanding what you feel like all the time. I mean, is that something that you should go to the doctor for anyways, if it's there for a long time? Yes. Chest pain, shortness of breath. I can tell you, just from experience, unfortunately, nausea tends to be the one that sticks out of all of them, that people just feel nauseous. I feel like throwing up. I can tell you, my mother had a heart attack, and the one thing that she stressed is that she felt like there was an elephant on her chest. And my mom had her heart attack. You got to realize she had symptoms prior to her heart attack for days. The one time where she couldn't escape the one symptom is where she felt like that elephant on her chest. She went to go lay down to think she could sleep through it. Thankfully, she woke up with so much pain. She called 911. She had 100% blockage in her main artery, 90% in her other, emergency angioplasty. But if she didn't feel that elephant, she would have died probably, eventually, because she could have just ignored the symptoms. And most people don't get a second chance with a heart attack.